uncertainty is so high, as already mentioned again by Dr. Comiso. And as well, in terms of governance, again, the previous speaker, Dr. Magtibay, also alluded to the role of or the importance of governance and social understanding. It's not just science, but we have to communicate science in a way that is easily understood. And of course, some of those social capital, trust building is also important. Now, our center, the Oscar M. Lopez Center, is very unique in the Philippines in that it is funded by private philanthropy. Our, shall we say, the billionaires in this country, they realize that climate change and climate risk is a real and present danger. And so they're putting their money where their mouth is. So the Lopez group of companies provided like a seed money or like a grant. It's substantial, it's about $3 million for us to be able to do research on climate change. So this is a very unique development here in the Philippines. And the vision of the center is a climate resilient Filipino society. The mission of the center is to become a leading catalyst in terms of science-based solutions. So it's a science organization. It's not just advocacy, but it is based on hard science. The purpose of generating science-based solutions. I'm sorry, I'll be a bit fast, time is so limited. There are two foci or focus of this organization, of our organization. One is science, the other is sort of outreach, or reaching out, or communicating. Just like a science organization, we do have a peer-reviewed journal. It's called Climate, Disasters and Development, and if you are a scientist or in science, you can actually publish your papers here. The other thing that we're doing is the Philippine Climate Change Assessments. These are like the Intergovernmental Panel IPCC assessment reports. And in fact, we're just launching just last month and just finished with, of course, Dr. Lorenzo being part of this, the second working group report. We also look at climate trends, what's happening with the climate in the Philippines. By the way, all our reports are downloadable freely from our website. You can get it freely wherever you are. We also do a lot of these science things. I won't go into details. This will probably bore you. But like flood mapping, vulnerability assessments, using technologies like LiDAR, satellites, remote sensing, all these kinds of high-tech things. We're trying to use these tools to generate solutions. We've been partnering with several organizations around the world. University of Lisboa in Portugal. We're trying to start partnership with Harvard University, Harvard Humanitarian Initiative, doing work, resilience, and looking at how to address climate and climate risks. We are, and also at the same time, trying to reach out, not just to scientists, but even to policymakers and even to the business sector. We have a grants program. We do give grants. It's not a lot. It's about $20,000 per year for Filipino scientists in our universities like Ateneo, LaSalle, UP, and even regional universities like Isabela State University, Silliman University. And we're providing weather advisories. We also have communication work. We try to link science and business. We try to bring these two communities together because we believe that not just scientists can solve these problems. We need the effort of all sectors.
Thank you very much, Dr. Lasco, for that very engaging presentation. And now finally, we are going to put all these things together and find ways in which we can really identify key areas that nursing can actively contribute to with a presentation of Dr. Lorenzo.
Good morning. It's great to see all of us here, and even greater that nurses are now embracing the concept that is much bigger really than the practice that we've known in our traditional practice. So I'd like to thank the organizers for really engaging the nurses in planetary health. And my task today is to discuss with you my thoughts on nurses' commitment and engagement. definition very quickly and what I think we need to do there. Nurse engagements will be identified very briefly, and also what we can do in terms of nurse commitments. Finally, we will end up with the next steps or approaches that we can actually do together, together within countries and across sectors to promote planetary health. So if we were to look at the planetary health definitions, there are quite a lot. But one that is very interesting and shortened that Erwin also used in his research is that it refers to the health of human civilization and natural ecosystems where human civilization and health depends. So if planetary health implodes and if it falls, then human health and our civilization as we know it will be no more. It takes into account and expands the concept of global health. So for those of us who know that what we do in our hospitals and in our communities are related to other countries and the other countries' problems, is well aware of global health. Case in point is the SARS that we've gone through a number of years ago, and also that came from China, but it circled around the world and touched every nation, including the Philippines. So now we know that when we take care of patients with viral problems, viral diseases, we also prevent the spread of viral diseases in other countries. If we don't, then it will spread. And with air travel and other modalities that bring us closer to each other around the world, we will be at risk. And so, but this planetary health definition, while interesting, I think needs to be operationalized. If we were to give this to an ordinary nurse or a nursing student, they will say, huh? What is this all about? And so we need to operationalize this so it becomes clearer what can be done and what engagement we can have. So let's talk about engagement of nurses. We need to move from our current nursing roles and commitments. In all our practice acts, it says that nurses must deal with individuals, families, and communities. However, our patients and this commitment needs to be expanded to have the environment as our patient or as our focus, and beyond that, planetary and global health. Now, if you were to say, but I'm not concerned about that, think again, because problems like the vaccine problem that we're now facing in the Philippines, the drug-resistant cases of TB and malaria, antibiotic resistance, all of these are affected by planetary health. How so? When we, in terms of nutrition, for example, we do not think that antibiotic resistance is affected by the food that we eat. But think again, the pork that you eat, the beef that you eat, and the chicken that you eat, they are all treated with antibiotics that go into the bloodstream of these animals' food that we consume. And it finally goes into our systems. And wonder of all wonders, when we're prescribed an antibiotic, then it will not.
I think that was very clear on what we should be doing as nurses. And I think in all these talks about planetary health, even at various international organizations, really how does the health sciences work together with the physical sciences and various major stakeholders in addressing the climate change and various planetary health issues. So, I'm just, again, thank you very much to our panelists, but I'm getting a barrage of questions here, so that just means that our nurses are really very interested in this topic. Just a quick question for all our panelists. how do you think can we best communicate climate change and health to our communities or to our patients? What's the best way? Like, if we're talking about, it's very difficult to talk about the melting of the polar ice caps, the increasing temperature, global warming, biodiversity losses, and many others. What's the best way, in your opinion, can we best communicate these issues? Dr. Comiso.
I can't really say which one is the best way at the moment, but I can make some suggestions. I think that we should start with younger people, get them with the basic principles of climate change, get them to appreciate what is changing and understand the implications of the changes. And I think that they should be the first to really recognize the problem, because it's their future that's going to be affected the most. So I think we should start from the young ones, because then if the young generations really appreciate that and get the ball rolling towards improving the emission, minimizing the emission that's causing the problem of climate change, then we would have a stride already towards solution of the problems. And of course, we need policymakers making the right decision as well towards trying to ensure that some of the basic criteria for minimizing emission of carbon dioxide are being implemented, like reducing the amount of emission from using fuel. We have the technology now to minimize that. 20 years ago, solar energy was not popular because they were very expensive. But now, especially in the Philippines, we have abundant sunlight, so that should be a key solution to the problem. Also, we can use wind energy, which is free, and that should be a very good solution as well.
Thank you. Yes.
Question is, what is the best way to communicate climate change and health to the people? So it depends on our target audience. Let's say, for example, the young generation that Dr. is saying, the millennials. So for example, for the millennials, they are computer savvy. So the social media is one of the appropriate media that we can use. Most of them, perhaps they have cell phones that have Facebook and Twitters. In the Philippines, we have more than 90% of the people have cell phones. So that's one media that we can use. But for the community with no signals of internet and others, so we will be doing the face-to-face communication with them. Our health workers can communicate face-to-face with the household by giving stories like the result of big typhoons or flooding that affected the community. Now, for example, the Haiyan typhoon that affected region 6, 7, and 8. The experiences there we can share, and we can attribute that to climate change. And the impact to health is also being documented, and we can share. And the other strategy is for the elementary school. So we can use this school environment to give orientation on climate change and health.
I agree with what's been said by my colleagues here. But think of this. You are nurses, and your patients are captive audience, right? They're not going anywhere. They're in their beds, and probably they want to talk to someone. And so you can start a conversation like, have you heard about the polar ice caps melting? And I'm sure they would want to talk to you because they have a lot of time. And so I think you are in a position to influence your patients, but just because of where they are and essentially their captive audiences. Now, I don't know how you will do it. And of course, that assumes you know a lot of information that you can share to them. But I think you're in a wonderful position to be able to spread the word that of climate change as well as biodiversity conservation. Just think about it.
That's a very interesting question. In my experience, there are two ways to do this, especially among students and some practicing nurses. One is to get them to sit down and watch film clips. I recommend one international one, Inconvenient Truth by Al Gore. I was just told Inconvenient Truth, sorry, that was written by the group of former President Al Gore. And there's a second Inconvenient Truth according to Dr. Lasco here, which is very interesting as well. My Masters of Public Health students were dumbfounded when we showed that to them, and they did not realize the urgency of climate change as a problem. And then, because many of our people, your family members too, are interested in a lot of apps. And I'm sure there are apps that they use like, how happy are you? Or how financially stable are you? Why don't we get them to a app? How climate resilient is your family? And so there are a lot of scoring games, and some of them are very, very short, and that could lead to their realization that they themselves are in a precarious situation and are facing a lot of risk. Then there are tools that may be used by our patients and communities, vulnerability assessment tools, and maps that Engineer Bonnie talked about. The maps especially are very useful. When we showed communities their community maps and where the rivers and the streams were, where the watersheds were, and even where the earthquake faults were, then it was easy for them to realize that, gosh, we have to move, we have to agree to move to a better place where we should reside so that we can become climate resilient communities. So there are a lot of these, but I think the first thing is to show them that this is an urgent matter. We cannot wait another 20 years. The time to move is really now.
Thank you very much. Which is, I would like to draw on that for the next question. It's like, with all these issues of NCDs, infectious diseases, all other issues with healthcare financing, why should we be so much concerned with planetary health or climate change? So,
for me, as a health professional, the answer to that is simple. We do not want to just be treating the symptoms and coming up with knee-jerk reactions to every problem that we face. We should be interested in looking for the root cause and have a chance at addressing this. Now, the root cause is planetary health. A lack of planetary health, I should say. And so, if we really do a very thorough analysis, it will point to that we have abused the environment, we have exceeded a stable use of our environmental resources that will actually sustain life for many more years to come. And if we do not address that, then lack of food, malnutrition will come in. Antibiotic resistance that I've talked about will come in. Will we wait until we're faced with those problems? From a public health point of view, we need to go back. And so I think it makes sense that we do.
I think it makes a lot of sense, as mentioned, because climate change could increase, for example, extreme events like typhoons. 3 years ago we had Yolanda or Haiyan in the Philippines. We can have more of those. So this is a public health issue. People will die. Thousands of people could die and could, of course, become ill because of climate change. We know that vectors of diseases like dengue and malaria could have reached new habitat, which of course could spread those diseases. And again, that could make your life more difficult. Not only that, think about pollution. Like in Metro Manila, as you know, a very polluted city, and so there are a lot of respiratory illnesses. So I guess there's a very real connection, and that is why you as health professionals, I think, should be very concerned about climate change.
For me, planetary health is a global health issue because in the global health phenomena, it's an interaction of environmental factors that affect health. For example, if we increase the temperature, as what our professor mentioned a while ago, let's say to 4 degrees centigrade. So what will happen to the ice? It will be melted and then sea level rise and so on. And not only that, it will affect air and will affect water quantity in other areas, in different parts of the world, not only for